Victoria, how knowledgeable are you when it comes to eye research? I find it fascinating and always want to learn more.
I agree, and I do try to stay up to date on the latest research and advances.
During the summer, researchers at the University of Alberta wrapped up the first stage of a gene therapy trial, the first of its kind in Canada.
Alex Smyth is about to have an eye appointment of sorts. He meets Dr. MacDonald, who coordinated the trial.
The eye is one of the most important organs in the human body. Recently, researchers at the University of Alberta conducted gene therapy trials focused on treating eye diseases. I'm heading back to school where I get a crash course in eye health from one of the people behind the trials.
So the compelling reason to do research is, if there's no treatment, let's find one. Hi, I'm MacDonald. I'm a professor here at the University of Alberta, and I've been here for now over 25 years. The thing that I'm really passionate about is heritable eye diseases.
What are some issues that affect eye health?
There are neurological conditions that affect the eyes. There are myopathies that affect the eye. There are metabolic problems that affect the eye. One of the major ones would be diabetes. There are disorders of refraction, and they're probably the most common. And we don't really think of these as being heritable traits, but they are. You can either be farsighted or short-sighted, and what your parents are is very much what you may become in terms of your refractive error. So maybe that's a little start to say just how much your genetic background contributes to your ocular health.
How can age affect vision?
If we think of age-related disorders of the eye, we get into the concept of age-related macular degeneration. And our population is living much longer. And as we're living more years, the likelihood of perhaps developing an age-related problem with vision becomes more likely. What would you think might be an important thing to do if you were in your 70s?
Diet and exercise?
Right, and that darn thing called smoking. And that's a major risk for age-related macular degeneration. So there's a great component of what we do in trying to educate individuals on their ocular health. But nutrition is a very important factor.
What is your area of focus?
My area of focus is heritable ocular conditions, and I see patients regularly every week with heritable disorders of vision. Usually retinal conditions. One of the major conditions that I've studied throughout my career is a disorder called choroideremia. It's a sex-linked disorder. We know it as a metabolic trait because that's the origin of this disorder.
What is gene therapy?
So gene therapy is basically designed to replace a faulty gene with a normal copy.
What can you tell me about the gene therapy trial you conducted here in Edmonton?
This was a brand new experience for us as a team, and a first event really in Canada to bring gene therapy to the eye. And it was a proof that we could do it. So setting up an experiment on ocular gene therapy here in Edmonton, we hope will pave the way for other trials that may be coming in the future for other disorders.